Hello, this is Abby here, and this is my presentation on my case study. First of all, my patient, her name is April, and she gets injured while pole vaulting, and she strains her left groin, and the mechanism of injury is hyperextension of the left adductor. The musculoskeletal injury here is the adductor longus muscle, which you can see right over here. It's this big muscle on the side of the leg. And the nerve involved with this is the obturator nerve. It innervates the adductor longus. And potential artery involvement is going to be a branch from the femoral artery and a branch from the internal iliac artery, which are smaller arteries, the profunda femoris artery and the obturator artery. And here is a model of my disablement. So the active pathology is going to be the strained adductor longus, and you're going to treat it with protection, rest, ice, compression, and elevation. And then impairment is going to be the musculoskeletal system, and the functional limitations. April's not going to be able to walk or jump or sprint, and her jumping and sprinting is going to work at 30% of the norm, and her disability is going to be that she can no longer pole vault. She can't fulfill her role as a pole vaulter. During phase 1 of healing, we do not want to use any heat because we are still in the inflammatory phase. Immediately after the injury, you're going to want to use ice or cryotherapy. The first 48 hours is definitely going to be rest, ice, compression, and elevate. You can also do a massage and ultrasound, also, the ultrasound cannot have any heat on it. And then you can also use a transcutaneous electrical nerve stimulation. For protection, you're going to want to have your patient rest completely, not even walk. No kind of exercises unless it's cryokinetic. So they will numb their groin, and they can do adductor exercises if they're numb, otherwise none. And in phase 2 of healing, there should be little to no pain during range of motion, and you still should not use anything thermal. So you're still going to want to use cryotherapy, non-thermal ultrasound, the electrical nerve stimulation, a lower level laser you can now use, and you can use therapeutic exercise as well. So active and passive range of motion, you're going to want to get them to have pain-free before you can move to the next phase. And your range of motions, you're going to want it to be within 80 degrees of their non-injured limb as comparing to it. And as far as balance goes, you're going to want to stabilize the core with sucking in the belly button into the spine during all movements. Doing core exercises such as these is going to help you to have an overall balance and build the strength in your core so that your lower body injury will not hinder you in any way. And then for exercises, you're going to want to make sure that you can do active range of motion without any pain before you move to exercises. And then you're going to want to move to resistance bands. And then you're going to want to move to, with the resistance bands, you're going to have isometric holds, and then you can move to a more active resistance band usage. And then a couple exercises you can do for the adductor would be hip adduction against gravity. So you can elevate your leg on a medicine ball, and you can be on a side plank and you can push down on the ball, and that will activate your adductor. You can do eccentric adduction, so you're going to focus on a slower movement during the relaxation. So the contraction will be fast and the relaxation will be slow. And side laying hip adduction, that's just going to be you're lying on your side, and the leg that is closest to the floor, you're just going to lift it, and that activates your adductor. And then as you can see in this picture here, she's doing ball squeezes. That will activate your adductors. And that picture over there is your resistance band adductor movements. Side lunges are also pretty good to strengthen up your groin area. Sumo squats as well. For phase 3 of healing, you're gonna wanna be completely pain-free before you're in this phase. And you can finally move to thermotherapy. You can use electrical currents, low-level lasers still, and also therapeutic exercise. And groin strengthening exercises can begin, again, as soon as pain allows after the initial acute injury healing phase. So if you still have injuries, you should not be exercising. And as far as the core goes, you can start moving to strengthening exercises. And some of these could be single leg glute bridges. And you're just gonna, while you're doing those, you're going to be performing the drawing in maneuver, where you pull your belly button into your spine. You can do planks with alternating legs, and that really focuses on your core. Side plank raises, while you raise your hand to the ceiling. That one's really good for your oblique area. And push-ups with your feet elevated, that allows you to use your core and your upper body. And then once you can do those, you can move into the power ones, which involve normally jumping and like throwing a ball on the ground. It's going to be very fast-paced. As far as balance goes, you should be returned to the normal balance you had before the injury. And a good way you can test this for your groin would be to balance on a ball and see if you can do that. And then as far as stretching goes, there are several good stretches you can do. As you can see in this picture right here, that is going to be passive range of motion, where someone pushes your leg out, and that's going to stretch your groin area there without you having to do anything. One that you could do on your own is this picture right here, where you basically sit Indian style and you push on your knees and you lean forward. And then there are some straight leg groin stretches, seated ones, and then a good hip flexor stretch is where you can either lie on your back and pull your knee to your chest, or you can get on a half kneeling state and then just lean forward, and that'll get a good adductor longus stretch as well. Exercises to return to play is going to be the snatch, which is similar to a clean, and a push press, band sprints, feet to bar, hanging leg races, towel chin-ups. And then you are good to go. And that is my works cited page.